organization. The University of Illinois Extension provides practical, research-based information and programs that help individuals, families, farms, organizations, businesses, and communities in Illinois. The University of Illinois Extension offers a variety of programming. We have programming in youth development, horticulture, small farms and local foods, nutrition and wellness, and also community and economic development. The University of Illinois Extension's Community and Economic Development team is pleased to partner with the University of Illinois' Institute of Government and Public Affairs to bring you this programming today. There are about 15 University of Illinois Extension Community and Economic Development educators across the state. They work to foster community leadership, facilitate community planning, assist business retention and development, stimulate community and economic development. So if you'd like to contact a CED educator near you, visit our website at extension.illinois.edu. But I want to take a moment to specifically thank the local government team that has diligently worked to put this programming together for you today, and that's Kathy Brown, Corey Buttery, and Ken Larimore. Just a few housekeeping items today. Just try to keep your microphone muted so that we eliminate any background noise. As far as the question and answer session goes today, which I'm sure you'll be anxious to get to, we will hold questions until the conclusion of all the speakers' presentations. We will take questions in the chat box located in the lower right corner of your screen, and we'll ask that you type those questions in that chat box at any time during the presentations. We will take those questions and keep track of them, so at any time during any of the presentations that a question comes to you, please go ahead, and we recommend that you jot those questions in that chat box, and we'll hold those until the conclusion of all the presentations. So we have a lot of information for you today. We have a great program. We're really pleased to be partnering today with IGPA. So let me please introduce our first presenter and co-moderator, Dr. Christopher Mooney. He is the director of the University of Illinois Institute of Government and Public Affairs. He holds a PhD in political science from the University of Wisconsin-Madison. Dr. Mooney is a founding editor of the top academic journal in his field, the State Politics and Policy Quarterly, and he has taught at West Virginia University as well as the University of Essex in the UK. So please welcome Dr. Mooney.
Okay, thanks a lot, Amy. And thanks to everybody and welcome. I will now turn off my video because the lighting is terrible and you can see my picture on TV, which is funny. We're here today to talk about Illinois' budget woes and our effort at IGPA to put together some discussion about how we might move forward on this. The Institute of Government and Public Affairs, or IGPA, is the University of Illinois' public policy think tank with a focus on the state of Illinois. We bring the resources of the U of I to bear on the public problems of the state. We've got a very long history of working on public finance in the state, research on the state economy, pensions, budget and spending, and so forth. Most recently, we have a group that's known as the Fiscal Futures Project, which is run by David Merriman and Richard Dye, and which one of our speakers today, Nancy Hudspeth, is part. And they have brought to our attention in some of their research in the last few years the extremely serious nature of the fiscal problems of the state. As you can see here, the state of Illinois has a serious structural deficit, a deficit between budget and between spending and revenue that's growing every day. This is a slide that sort of tells the sad truth that the Fiscal Futures folks have put together. what this demonstrates, if you look at the solid line on the bottom, that is the predicted budget gap going forward if no current law is changed. And you can see it gets to sort of $14 billion a year, this is, in deficit by 2025 if nothing has changed. The dotted blue line demonstrates what is predicted to occur if the SB1, the current pension reform that was passed in December, if that stays in place, which now is highly doubtful given Knerr versus Weems' decision last month. And the green dotted line above is the prediction for if the SB1 pension reform stays in place and if the temporary tax increase that's due to expire or to roll back considerably in January, if that stays put at its current level, the fiscal futures people predict it will be at that green dotted line level. Even that, what that demonstrates is even that does not get us above the zero line, and the zero line here would be where revenues match expenses. We will be in deficit, and increasingly so if something is not done. The Illinois Budget Policy Toolbox is our attempt to help inform the public conversation about various aspects of the situation in this crucial year. Not only do we have the structural deficit ongoing and getting worse, we have the so-called fiscal cliff coming up in January with the tax increase going off, and we've got a gubernatorial election that really is going to have a significant impact on the budget going forward, and we think some of the information about the budget and the fiscal situation of the state should be high on voters' priorities as they go to the polls this year. The toolbox consists of short pieces of analysis on background issues, on revenue options, and on spending options that were written for sort of the smart newspaper reader, not economists or political scientists. This is information that the informed voters should know: pros, cons, impacts, and so forth of these various aspects of the budget. There's also some other kind of commentaries that were written and magazine articles that came off of, and you can find those all on the website too, which I'm showing you here, but I'm not saying the URL, but I think that we'll make that available to you as needed, as desired. Now today we're going to offer a few insights from some of these analyses, and there'll be plenty of time for Q&A, hopefully. In May, we did the first of these, and we ran through some of the background issues, telling all the doom and gloom story about the budget going forward. In June, we did a webinar in which we had three of our economists talk about various revenue options, and both of these webinars are archived, so you can get to them when you wish through the extension. Today we're going to talk about various aspects of spending and how that can be a piece of the solution. We're going to start off with Rick Winkel, who is going to talk about so-called bending the curve. Rick is the director of the Office of Public Leadership at IGPA. He is a former state senator and state representative from the Champaign-Urbana area, and he has taught at the UI Law School and is very much involved with a lot of our leadership programs. So I'll hand it over to you.
Thank you, Chris. I wanted to emphasize that I work with the Fiscal Futures Project. I'm not an economist or a political scientist. As Chris said, I'm a former legislator, director of the Office of Public Leadership. So I'm attacking the subject from that angle, from that perspective. On this page, I want to draw your attention on the bottom. There's a link to the Fiscal Futures Project. I would ask that if you're interested in knowing more about the Fiscal Futures Project, that you click that or go to that linkage and check it out. It's about long-term budgeting and transparency, and Nancy Hudspeth will talk more about that later today. So Illinois faces some very harsh fiscal realities. As Chris has already alluded, we have a structural deficit. It's dogged us for many years. This is not a new phenomenon. It's not a product of the recession. even though the recession exacerbated things and made it very evident, obviously very clear that we have a problem. But Illinois for a very long time has had a large and growing gap between our sustainable revenues and projected spending levels. And sustainable revenues, we're not in the Fiscal Futures Project, I can tell you, including borrowed funds or borrowing as not counting that as income. So we have that, a structural deficit with the deficits that we hear in the press annually that are persistent, but we also, on top of all that, have the largest in the nation unfunded pension liability. Now, Dick Dye from the Fiscal Futures Project did a presentation the other day for us and talked about $100 billion as being that unfunded pension liability. But he also made it clear that that's probably a very conservative estimate, that it's actually probably much higher. But it's worst in the nation. That's what we need to know. We have a harsh fiscal situation and a tough economic climate. So we have some painful choices. It comes down to politics. Politics is deciding who gets what, when, and how. And in this kind of environment, it makes it very challenging. So what can policymakers, what can our legislators, what can the governor do to reduce Illinois' structural deficit? Can they bend the cost curve, and what is that? And we'll talk about that. I would just say up front here that Illinois policymakers are faced again, they were this year and they will for years to come, with many tough budget choices because of the structural deficit. So can one thing solve it? Can they just simply cut their way out of it? No. Can they spend their way out of it? No. It's going to have to be a combination of things. So should they cut spending, and how much, and what spending should be targeted? Should they cut across the board? Will the spending cuts be immediate or phased in? What taxes, if they're going to raise taxes, what should they raise? Should they extend the income tax increase, or should they broaden the tax base? Should they tax services? It's the fastest growing sector of the economy compared to the manufacturing or the goods part of the economy, or tax retirement income, which always sends up shivers of every legislator's spine when you raise that one. So there's backlash. There's the political problem. The fact of the matter is, this is a political situation as well as an economic and fiscal one. What is the political situation? Well, every 2 years, state representatives, every 4 years, state senators have a job interview with the electorate. They're put up for election. They're concerned about being reelected, and that's a real issue. So plans to cut current benefit programs create strong and immediate backlash from recipients and other interested groups. So these are people that are involved in the elective process, and therefore legislators and the governors pay very close attention to the reaction within the citizenry and the taxpayers. So beneficiaries count on state expenditure programs, and they think, from their perspective, that if we change things now, we're changing the rules in the middle of the game. So it's really, for many people who legitimately depend on state programs for their well-being and perhaps even for their very lives, fairness is an issue. Fairness may require giving beneficiaries of state programs enough time to adjust to reduction or elimination of state services. So that's an issue as well. So the question is, can policymakers, can our legislators and the governor reduce the structural deficit by bending the growth of state expenditures, by bending that curve? It's had an upward trajectory. It's growing faster than our revenues, thus creating the structural deficit. Can we bend that curve downward to improve upon that imbalance so that the expenditures do not grow as fast as currently projected? The short answer, as you can see, is yes. At least that's our belief. Even without actually cutting state spending, Illinois policymakers can reduce the budget deficit by slower growth in future spending. So when we talk about bending the cost curve, we're looking at future projections of government expenditures, and can we slow that down? So bending the curve. It focuses, as I said, on future or projected costs. Illinois policymakers have already started this work. They've adopted austerity measures that we know about in the past, the previous session, not this spring, but the previous spring. They adopted austerity measures, and earlier before that, the past 2 to 3 years. So effective January 1, 2011, Illinois policymakers enacted a temporary increase in the personal and corporate income tax rates. And now I realize we're talking about expenditures today, not revenues, but it's all part of the structural deficit. And they capped, and this is where you start bending the curve, they capped the growth of general funds spending. So that's in there as well. So it's a 2% cap on the future spending, 2% per year from 2012 to 2015. So that was a part of that plan that was adopted a couple of years ago. Now that phases out, the income tax increase phases out January 1, 2015. Now in the Medicaid program, again, it's a package. It's revenues and cuts and efficiencies. The revenue was increased in the effort to save the Medicaid program that was approved June 14, 2012. It increased the cigarette tax. It raised about $675 million, at least that's what it was projected. I'm not sure exactly what the numbers have actually proven, but that was the plan in the new revenues for Medicaid. In addition to that, cuts were enacted to the benefits, which is very difficult to sell to the legislature and to the governor, but through negotiations they did do this, they did take these steps, and they also included efficiencies within this package that would save about $1.6 billion in fiscal year 2013. Now, so that's an example of a package that bends the curve and helps to raise or increase the, make the budget less imbalanced, to, in other words, ameliorate the cost or the expenditures as they increase from year to year. In addition, and I know Nancy Hudspeth will talk about this in more detail, but they also have adopted reforms to the budget process that could result in future cost savings, in the sense that if you have better information, if there's more transparency and accountability, clarity in the timetable for the budget process, we like to think that then legislators and the governor can make better decisions fiscally. So what more can Illinois do to bend the curve toward balancing the budget? The Fiscal Futures Project researchers have recommended options that legislators and the governor attempt to bend the curve by making the package to save Medicaid that I just described, making those adjustments permanent, so as to slow the cost of the program, and they need to adopt policies to increase the revenue that coincide with projected increases in the Medicaid program, and also as we look ahead to the phase-in of the ACA, or what's popularly been called Obamacare. So we also, that's just one example, but we need to identify costly inefficiencies in state government and state government programs, how we deliver them. We need to do it more effectively and efficiently, and we need to correct these programs by legislative action. We need also to adopt more reforms to the budget process itself. So what did the governor and the General Assembly do for the new fiscal year, for fiscal year 2015? On May 30th, the governor and the General Assembly adopted a deficit budget and put off the tough decisions that we've been kind of talking about, and we'll talk about more, to balance the budget. So there was no bending the curve this year. The new budget did not extend income tax rates that will begin phasing out January 1, 2015, and it did not cut spending, which means there will not be enough revenue to pay for the operating expenses. Thus, the new budget for fiscal year 2015, which went into effect July 1st, the new budget authorizes borrowing from next year's budget and shifting revenue from last year's budget to pay for this year's operating expenses. Consequences, just a couple days after that was adopted on July 3rd, the Illinois Supreme Court signaled that it will likely declare recently enacted pension reforms as unconstitutional. Therefore, the concept of kicking the can down the road just got more costly in the long term in the face of having to redo pension reform. Therefore, I would submit that the pressure for a more comprehensive solution to the state budget imbalance and pensions will be and should be very intense in the years to come.
Okay, well, thanks a lot, Rick. Next up, we have Professor Elizabeth Powers. She is a economist at the University of Illinois Urbana-Champaign, and she's going to talk to us about human service spending.
Thank you, Rick. Thanks, Chris. So I'm going to talk with you today about waste, fraud, and abuse in human services, and this is taken from a longer piece which was written for this Illinois Budget Policy Toolbox, and if you're interested in further details, that's a good resource. Illinois, like other states, has a number of welfare programs, human service programs. Some of these are Medicaid, food stamps, and the child care subsidy program. And the idea that there's a lot of undeserving recipients or fraudulent recipients in these programs is a popular, long-standing one. Of course, it's a laudable goal to want to run programs efficiently, which means you want to attain your program goals at a low cost. It's often asserted by you see this on editorial pages, and you hear this in political speeches, that there's all kinds of waste, fraud, and abuse in the social welfare programs, and that certainly seems to conform well with public opinion on that issue as well. That could be a potentially very important source of cost savings because 40% of state spending is in the human service program. So it is very important to ask about the efficiency in the administration of these programs, and it's a potentially important question as to how much money could be liberated for other uses through human service program reforms that target waste, fraud, and abuse. We have some recent direct experience in this area. The state has embarked on a number of what I would call scrubbing projects, and that's basically you go and you examine every single person in a particular program. You start with the premise that perhaps they shouldn't be on the program, and let's prove that they should be on the program and receiving the benefits that they're getting. The premises for this strategy as a cost reduction strategy are that when you go to do this in a program, you'll find a lot of undeserving or fraudulent recipients. Also that these types of recipients are accounting for a large amount of the benefit payments that you're paying out. And of course also you're weighing the cost of auditing all these cases versus the gains from discovering all these benefits that shouldn't be paid out, so the assumption is also that investigations of this type are fairly cheap. Okay. As I said, we have particular experience with this strategy just last year, so this serves as kind of a case study for us. We can look at Governor Quinn's scrub of the Medicaid rolls in 2013. So this was, in 2014. It was proposed in 2013 as a means of saving about $120 million out of Medicaid. A contractor did the initial look at every single person, every single household that was receiving Medicaid in Illinois, and the rate at which they recommended case cancellations was about half. When state workers looked a little more closely, they still recommended that about a third of the cases maybe shouldn't be on Medicaid. So you would think that there would be substantial savings perhaps from then getting these people out of the system. However, there were some unexpected developments with when they went ahead and canceled cases. First, they found that very shortly a pretty substantial fraction of people came back on Medicaid. So 20% came back almost immediately, within about the amount of time it would take to turn the paperwork around, with more coming back as time went by. So, you know, a lot of these people actually were closed out of Medicaid too quickly without enough information. Second of all, of the people who were turned out, few of them had been using Medicaid very much anyway. They weren't really the expensive cases. And many had not used any services, in fact, for 6 months or more. So they had basically already self-unenrolled themselves. Considering the expense of looking at every single case in this detailed way, and then considering the rather disappointing benefit yields from that, and putting all those figures together, the projected the state will net at most $50 million versus that initial $120 million that was hoped for. Okay, so you know, it's a very popular position that there's a lot of waste, fraud, and abuse on the part of recipients and programs. You know, we have actual experience with this, which suggests that these savings aren't as large as people might like to believe. So what could we do instead to help welfare programs, human service programs run more cost effectively in the state? Using evidence from other states and from Illinois' past experience, the recommendations that I would put forward would be to first invest the greatest enforcement effort at the initial screening of people who are coming into programs for the first time. Try to develop processes to weed out people who are likely to commit fraud at the beginning. Secondly, and this is a long-standing issue in the state of Illinois, we still don't have information systems for human services that can be accessed by caseworkers across different programs. That kind of information sharing would help the state administer the programs much better. Thirdly, in Illinois, sadly, we often see that the types of entities that are abusing programs are vendors, that is, people contracting with the state to provide a human service to an individual, and that vendor abusers, or at least anecdotally, appear to often be political insiders. So we should have more scrutiny of the true risks of human service fraud, and that they don't come from the beneficiaries so much as they come from vendors. And finally, also with regard to vendors, there have been some proposals to implement wholesale state contracting reform. There have been some moves to reform state contracting, but things like the recent anti-violence program debacle is just yet another example of the types of problems that Illinois has had with human services contracting, and it appears to be very much an ongoing issue. And finally, I think I have one more slide. So where are we headed with this issue? Well, you know, given our actual experience, we would think maybe this idea of scrubbing a program from top to bottom is becoming less popular, but that's certainly not true. In the gubernatorial campaign, Bruce Rauner recently has as a budget reduction platform plank that he'll find $250 million of savings through Medicaid verification reform, which is in fact what we just went through, and we found $50 million of savings. And also, Governor Quinn seems very committed to this idea of scrubbing programs, and has gone forward with a similar sort of audit strategy against state employees and retirees, also in an attempt to find people who maybe shouldn't be receiving benefits from the state. Thank you.
Thanks very much, Elizabeth. Next up, we have Dr. Anthony Sasso, who is a professor at the U of I in Chicago. He is in the Division of Health Policy and Administration in the School of Public Health, and he focuses on health economics. Tony?
Thanks, Chris, and good afternoon, everybody. I'm happy to be here talking about this issue with you all. The situation in the state of Illinois with regard to health care is unfortunately no less complicated and fraught than the other issues that you'll be hearing about and that this overall project has highlighted. So just to give you a little bit of background, the state spends roughly just under $7 billion on healthcare. That's the actual state dollars that are accounted for healthcare. Much of this is the Medicaid program, and nearly all of it. And the bulk of it is on medical assistance, though a good chunk is still long-term care. In terms of where Illinois on per enrollee spending ranks, it's pretty much in the middle, if not a little bit below, according to some of the most recent numbers we could get. In general, though, that's driven really by the fact that for the aged population, Illinois is considerably below the national average, and that's likely owing to Illinois' lowest in the nation Medicaid long-term care reimbursement rate. So that's a little bit of the background. Of course, many of you, I'm sure, have heard of the Affordable Care Act, and that has changed things and will continue to change things going forward. So specifically, the efforts to enroll the uninsured will increase Medicaid enrollment, as well as increasing private enrollment in the health insurance exchanges in Illinois. The newly eligible Medicaid enrollees, I'll distinguish between those newly eligible versus those who were eligible and get enrolled as a result of the effort to make sure that people have health insurance coverage. The newly eligible Medicaid enrollees will be entirely federally subsidized for the first few years, and then beyond that, the feds will pay about 90% of their costs. For the other previously eligible Medicaid enrollees, the state and the feds will split the cost 50-50. So there will be expenses there on the part of that Illinois will have to pay for going forward. The policy options, though, in Illinois are a bit limited at this point. Elizabeth just talked about one aspect of this law, the SMART Act, Save Medicaid Access and Resources Together, which, among other things, lowered provider payments, increased user fees, and other changes here included efforts to fight fraud in the Medicaid program. And you heard about the somewhat limited success from Elizabeth about that program. So, this nevertheless was a law that tried to get at the remaining low-hanging fruit in the Medicaid program in terms of spending reduction options. And the bottom line is that it's hard to wring any more savings out of the program. So, and as I already indicated, Medicaid nursing home reimbursement is already the lowest in the nation, so it can't easily go much lower than that. The state is pinning its hopes largely on care coordination efforts to save money going forward with Medicaid. And the goal is to facilitate better patient-provider communication. But there's reason, though, to be skeptical that much in the way of savings can be realized from these efforts. One well-done study by the Congressional Budget Office of 30 different disease management and care coordination programs found that they were really just as likely to increase costs as they were to decrease costs. And overall, the program had no effect on the different programs had no effect on spending. In terms of solutions, then, where does that leave us going forward? As I've alluded to here, there's little reason really to be optimistic about the state's chosen approach. And the question then is, well, do we want to look to more radical solutions going forward. The one example that we can take from another state, and this is just starting, is in Arkansas, which has been on the forefront here of the so-called private option model, where the effort is essentially to enroll all Medicaid, to basically fold the Medicaid program into the state health insurance exchange, and so really to not in any way cash out of Medicaid, but really to move Medicaid enrollees into private health insurance plans. And so Arkansas got a waiver to do this, and it's very early, but there are two authors here in Health Affairs Journal had commented that there's some reasons to be optimistic about this path, and obviously this would be a very involved choice for the state, and also fraught with many concerns along the way. So the overall final thoughts that I can offer is that the state's rather timid approach to cost control, we think, is unlikely to yield meaningful savings for the Medicaid program going forward. Spending will continue. There will be sources that increase that spending above and beyond the demographics of the aging population, but in also the form of new enrollees into the Medicaid system. And then the real question, I think, before the state is whether broad, out-of-the-box type thinking is going to be required to find some real savings and prevent Medicaid from continuing to consume ever larger fractions of our state's spending. So thank you.
Great. Thanks very much, Tony. Finally, we have Dr. Nancy Hudspeth. She is the Associate Director of the Fiscal Futures Project. She has a PhD in urban planning policy from the University of Illinois at Chicago, and she's going to speak about fiscal planning. Nancy?
Yes, hi. I'm a planner, so I'm going to talk about fiscal planning today. We've had some very serious discussions here about the difficult choices that Illinois has, but Illinois also does not do a very good job of fiscal planning either. So there are some areas that Illinois could make some changes. Last February, a national think tank called the Center on Budget and Policy Priorities conducted a 50-state study that graded states' use of 10 budgetary tools. These tools are considered to be best practices that governments use to plan for the future and to manage their finances in a responsible way. In the study, the states were graded and received a score from 0 to 10, with 10 being the highest possible score, and Illinois only scored 4 out of 10, which was well below average with respect to the use of these budgetary tools. Only 6 states scored as low as or lower than Illinois. I don't think it is a coincidence that Illinois happens to be a state with one of the worst fiscal situations in the United States. We have the worst underfunded pensions systems, and we have the lowest bond rating of any state. And also, Illinois scored so poorly with respect to the use of these budgetary and fiscal planning tools. So today I'm going to talk about the 5 areas where Illinois could improve and learn from other states that use these planning tools successfully. These areas are long-term forecasting, current services baseline projections, consensus revenue forecasts, fiscal notes, and rainy day funds. So we all know that state budgets change over time due to economic conditions and population growth, changes at the federal level, and other factors. Planning for fiscal sustainability begins with estimating the historical trends of different types of revenues and expenditures, and then projecting these growth rates into the future. Currently, the state of Illinois does not prepare long-term forecasts. Since fiscal 2012, the Commission on Government Forecasting and Accountability and the Governor's Office have developed 3-year budget projections of just the general fund budget, though, which is about half of the state's total budget. There are no projections for revenues and expenditures that fall outside of the general fund's budget, which is much of what we spend on Medicare, for instance, comes from special funds, but also the state motor fuel tax revenues don't go into the general fund, and also the Department of Transportation budget is completely outside of the general fund. So ideally there would be a 10-year projection of the total budget issued every year. As you can see on the slide, I've shown you what the Fiscal Futures Project here at the University of Illinois Institute of Government and Public Affairs does. We have provided unofficial long-term forecasts of Illinois' revenues and spending for the last 5 years. And as you can see in our slide, our forecast shows expenditures growing faster than revenues over the long term, which does add up over time. The second area is what's known as a current services baseline estimate, which is just an estimate of the cost of continuing a particular program in its current form without making any changes for at least 1 year in the future. We know that even if a program doesn't change, there will probably be some cost increases from 1 year to the next due to things like inflation or salaries or changes in the number of people being served. These factors would all be included in a current services baseline projection, meaning that this is the amount we need to budget for the next year and possibly the next several years, ideally, if we aren't going to make any cuts to the program. As you can see in the slide, what I've shown is an excerpt of the Illinois operating budget that was Governor Quinn's budget from earlier this spring. And as you can see, it shows line item allocations for agencies and for programs with columns on the left for actual spending in the prior year, fiscal 2013. The center column shows estimated current year spending for fiscal 2014, and then the recommended, or in the red, not recommended appropriation for the following year. But these numbers are all listed in nominal dollars, so this isn't really the same as a current services baseline projection, which would show lawmakers and the public whether a proposed budget reflects a real spending cut or a real increase, again in real terms. So the third area that Illinois could improve is in their use of revenue forecasting. A consensus revenue forecast is one that is endorsed by both branches of government, the legislative and the executive branch. Consensus revenue forecasts are prepared in 27 states, but in Illinois, each branch of government prepares its own revenue estimates. What I've shown in the slide is an excerpt from the annual revenue report that is produced by the Commission on Government Forecasting and Accountability, and they show their estimate alongside the Governor's Office estimates. And the concern that people have with respect to the fact that there's two different forecasts and there's two sets of numbers is the fact that it becomes then a political issue, and instead of discussing how we're going to spend the resources that we do have, we get into a political debate about whose numbers are correct. Some states go farther and adopt a binding revenue forecast in which there are mid-year corrections if spending is increasing and going over the amount that was agreed to be spent in terms of the revenue forecast. But Illinois doesn't go that far either. The fourth area where Illinois could really improve is in its use of fiscal notes. Fiscal notes are statements that accompany a bill, and they detail the costs or savings or revenues associated with the legislation. Some even provide projections of future impacts. While some states prepare fiscal notes for a majority of bills, or at least a majority of the significant bills, Illinois is seriously deficient in this area. Illinois is one of just 11 states with very poor practices with respect to fiscal notes. Even worse, the use of fiscal notes in Illinois has declined steadily over the past decade. In the 98th legislative session that just ended, of the bills that reached second reading, which is the point where fiscal notes can be attached, only about 3% were accompanied by fiscal notes. In contrast, 10 years ago in the 2003-2004 legislative session, 11% had fiscal notes. Because the preparation of fiscal notes can delay a bill's progress through the legislature, fiscal notes may be requested by a bill's opponents as a way to kill the legislation before it's called for a vote. However, some states prepare fiscal notes long before the bill reaches second reading, which means that the time needed to perform the technical analysis does not delay the bill's progress, and this essentially takes the politics out of the situation with respect to fiscal notes. Improving and increasing the amount of information that's available to legislators when they vote on a bill would be a relatively simple way to improve Illinois' budget process and even possibly fiscal condition. The last area where Illinois could really improve is in the use of the rainy day fund. Illinois is one of only just 4 states identified in the Center on Budget and Policy Priorities study that do not have a well-designed rainy day fund, which is just simply a system of cash reserves that can be used to stabilize a state's finances in the event of an economic downturn, which we pretty well know that is going to happen. Things go up and then they go down in a cycle. So let's plan for the cycle. Illinois does have a fund called the Budget Stabilization Fund, which was established in 2000. In a typical year, the Budget Stabilization Fund, as I've shown on the slide, the excerpt from the Comptroller's website where you can look up the information about the Budget Stabilization Fund, and in a typical year it's used to transfer about $270 million back and forth between itself and the General Revenue Fund. That may sound like a lot of money, but it's minuscule compared to the size of the total state budget, which is about $65 billion. Currently, according to the Comptroller's website, as I show on the slide, the balance in the Budget Stabilization Fund is only about $740,000, which is about 1/1000th of 1% of the total state budget. In order to be effective, some experts recommend that a government's rainy day reserves would equal 10 to 15% of its total budget. For Illinois, this would suggest keeping about $10 billion in a reserve fund. In conclusion, Illinois has a chronic structural fiscal problem that's so great that its budget deficits can't be eliminated by increases in economic growth alone or by the recent changes that were made to the state retirement systems that may have to be redone again. So improving the state's budgetary practices would be one relatively simple way to at least help improve its fiscal outcome going forward. We can put systems in place that would force policymakers to plan for economic cycles and changing demographics in order not to get caught aware when these things do occur. Better financial information, clearly presented, is essential to intelligent, thoughtful planning for Illinois' future, so that we don't keep repeating the mistakes that we've made in the past. Thanks.
Thank you very much, Nancy. We have time for questions now, I take it, yes?
So,
absolutely, and I think we have one down in the chat box that's directed to Dr. Hudspeth, so I can read that.
Sasso,
it says, what states do the best job at particular forecasting?
In Chicago, he is in the Division of
There's actually 10 states that were identified, or I'm sorry, 16 states that were identified in the study that do a good job of forecasting. And these would be Colorado, Connecticut, Georgia, Kansas, Minnesota, Nebraska, New York, Virginia, Tennessee, Washington, West Virginia. There's a list of these states in the study, which is called Budgeting for the Future. Fiscal Planning Tools Can Show the Way, and you can find it on the Center on Budget and Policy Priorities website. But basically there are 16 states that they've identified that do a good job in terms of their long-term forecasting. I hope that answered the question.
Great. No, thank you.
Yes.
Were there any other questions? I think someone's typing one. Yeah, yes, she said yes, thank you. So That definitely did.
Okay.
So I think we have another question. I'll read that. I'll read that out loud, and I'll allow whichever one of the presenters appropriate answer it. Has any state really gotten Medicaid spending down, and how? So maybe Dr. Sasso wants to address that first.
Well, it's definitely a good question. I think all states are struggling in one way or another with Medicaid spending. You know, this is to some extent why there's been I guess you could call it sort of a backlash in some states choosing not to expand their Medicaid programs as part of the Affordable Care Act, even though the costs, as I said, associated with newly eligible individuals will be covered for the most part going forward. So, you know, I don't know I can't speak to what extent that's a political reaction or to what extent that represents a real concern about ultimately being on the hook for greater spending. But it does signify, you know, a certain level of concern with Medicaid spending. As I indicated in my slides, I mean, I do see this Arkansas experiment. There are waivers and Arkansas is one of them, that some states are trying to implement to create different types of, ideally, you know, creative solutions to handle Medicaid spending. But in terms of the question about who's got things under control, it's hard to say. I mean, Indiana, for example, our neighboring state, has pushed health savings accounts, some form of that into their Medicaid program as a way of trying to control costs. I mean, other states are trying other approaches, but it is definitely a big problem, and I think the Affordable Care Act, in terms of the newly enrolled but previously eligible individuals who are out there, you know, they will continue to stress state budgets.
Okay, thank you. We have a couple more questions coming in. So the next question is for Dr. Powers. Why were people going off and on Medicare after the scrub?
Well, excuse me. The issue with eligibility status is often changing. So, you know, if you think about how you determine a person's eligibility for a program, it's things like their income and their family structure, and in the case of Medicaid, even their medical expenses. And these variables are always changing. So
yes, hi.
you look at the caseload.
I'm a planner, so I'm going to talk about fiscal planning today. We've had some very serious discussions here about the difficult choices that Illinois has. But Illinois also does not do a very good job of fiscal planning either. So there are some areas that Illinois could make some changes. Last February, a national think tank called the Center on Budget and Policy Priorities conducted a 50-state study that graded states' use of 10 budgetary tools. These tools are considered to be best practices that governments use to plan for the future and to manage their finances in a responsible way. In the study, the states were graded and received a score from 0 to 10, with 10 being the highest possible score, and Illinois only scored 4 out of 10, which was well below average with respect to the use of these budgetary tools. Only 6 states scored as low as or lower than Illinois. I don't think it is a coincidence that Illinois happens to be a state with one of the worst fiscal situations in the United States. We have the worst underfunded pension systems, and we have the lowest bond rating of any state. And also, Illinois scored so poorly with respect to the use of these budgetary and fiscal planning tools. So today I'm going to talk about the 5
Yeah,
areas where Illinois could improve and learn from other states that use these planning tools successfully. These areas are long-term forecasting, current services baseline projections, consensus revenue forecast, fiscal notes, and rainy day funds.
Program at this moment.
So we all know that state budgets change over time due to economic conditions and population growth, changes at the federal level, and other factors. Planning for fiscal sustainability begins with estimating the historical trends of different types of revenues and expenditures, and then projecting these growth rates into the future. Currently, the state of Illinois does not prepare long-term forecasts. Since fiscal 2012, the Commission on Government Forecasting and Accountability and the Governor's Office have developed 3-year budget projections of just the general fund budget, though, which is about half of the state's total budget. There are no projections for revenues and expenditures that fall outside of the general fund's budget, which is much of what we spend on Medicare, for instance, comes from special funds, but also the state motor fuel tax revenues don't go into the general fund, and also the Department of Transportation budget is completely outside of the general fund. So ideally, there would be a 10-year projection of the total budget issued every year. As we can see on the slide, I've shown you that the Fiscal Futures Project here at the University of Illinois Institute of Government and Public Affairs we have provided unofficial long-term forecasts of Illinois revenues and expenditures over the last 5 years. And as you can see on our slide, our forecast shows expenditures growing faster than revenues over the long term, which does add up over time. The second area is what's known as the current services baseline estimate, which is just an estimate of the cost of continuing a particular program in its current form without making any changes for at least 1 year in the future. We know that even if a program doesn't change, there will probably be some cost increases from 1 year to the next due to things like inflation or salaries or changes in the number of people being served. These factors would all be included in the current services baseline projection, meaning that this is the amount we need to budget for the next year and possibly the next several years, ideally, if we aren't going to make any cuts to the program. As you can see in the slide, what I've shown is an excerpt of the Illinois operating budget, the Governor King's budget from earlier this spring. And as you can see, it shows line item allocations for agencies and for programs. The column on the left, potential spending in the prior year, fiscal 2015. The center column shows estimated current year spending for fiscal 2015. And then the recommended or in the red, not recommended appropriations for the following year. But these numbers are all listed in nominal dollars, so this isn't really the same as the current services baseline projection. It should show lawmakers and the public whether the proposed budget reflects a real spending cut or a real increase, again in real terms. So the third area that Illinois could certainly is in their use of revenue forecasting. Consensus revenue forecasting is limited and endorsed by both branches of government, legislative and executive branch. Consensus revenue forecasts are prepared in 27 states, but in Illinois, each branch of government prepares its own revenue estimate. What I've shown in the slide is an excerpt from the annual revenue report that is produced by the Commission on Government Forecasting and Accountability, and they show their estimate alongside the Governor's Office estimate. And the concern that people have with these estimates is that there's 3 different